Hi, everyone. Welcome to Pivotal Practices. And this is our 11th episode, and we are so excited to have you join us. Remember that you can always subscribe and you can hit like, but you want to actually hit the subscribe button under the actual channel, and then you can sign up and know when the new podcasts are released. And so we also have a special guest today, and she's been here before. She was on our third episode. And so if you remember my dear friend Laura, who is a registered RN, and I just want to have you one more time introduce yourself in case we have new people watching.
Sure.
Yeah.
I'm Laura. I'm a registered nurse and recently board certified nurse coach. I have been seeing Teresa for several years
Yeah.
with Reiki, and also studied under her as well, and am an independent Reiki master. So I'm able to teach Reiki to others and attune others, which is exciting. I have been a nurse for, let's see, what year is it, right? 27 years.
Wow.
Yeah, wow. Mostly pediatrics, but basically, family medicine kind of in that group. I also was diagnosed with MS, so I have just a different, appreciation for autoimmune disease and an appreciation for what Reiki and other energy medicine and alternative medicines can do for you in complementary, I should say, or in conjunction with, modern medicine. Know what I mean?
Yes.
Medical.
When we did the last podcast, we had talked about how Laura has really been more like in a remission state for a long time, and how the continual alternative piece, still combining it with medicine, has helped keep you in remission with no new lesions and other
Yes.
things. So that's been a really beautiful part. So she has this living testimony of how these alternative therapies have helped change her life. So today we're kind of talking what I would almost say is like a taboo subject,
Yeah.
but it's one that is like so important that we talk about. And so please remember that, when we're talking in this podcast, we're not at all ever putting down the medical field. I mean, you have two people that are medically licensed that are sitting in this room, but what we want to talk about is the proper patient care and patient rights today, and alternative therapies, and how to combine different things and other faucets that come off of those subjects. So really where we want to start is that patients have rights, right?
Yes.
And just like there's HIPAA laws and certain information that we can't share about the clients that we're seeing, patients have rights. And so when we're speaking in that way, that also means that the care that you get, you have the right to say yes to specific medical care, and you have the right to say no. So one thing that I would include with this means that, we were talking about this earlier, there's like a standard of care now. Things are a little bit different than 20, 30 years ago. And, there's a bigger brother organization over the medical field that says, due to this diagnosis, this is the proper way that you care for this patient, and the doctor has to follow this protocol. So the doctor can't veer off of that protocol, which we would say maybe back in time that the doctor could think of many different ways to approach that client, or different approaches that might maybe come up to 3 or 4 different ways to actually treat this. And just like medicine is a practice, the doctors are learning. We're all learning as we're also caring for patients. But that also means that then the leniency on what the doctors can do or suggest is different.
Yeah.
Yeah. And
a lot of good practitioners will really provide research-based care and have a lot of just have the safety behind their knowledge, and have the research of what outcomes are available, and with that there should also be a presentation of possible side effects, possible things that could go wrong as well, so that you see as a patient the entire picture, and that you really are an informed consumer, right, in healthcare, just like everything else.
Yeah. So we're talking like about informed consent and like the reality that everything medical, it doesn't matter who you're talking to, everything medical comes with a risk. Any kind of treatment that you get comes with a risk. And so clearly if your health is in a like more of a good, healthy level, the risks are going to be a little bit more minimal with certain procedures and things. But then depending on how serious your medical history might be, those risks could escalate, right, to certain outcomes. So a doctor should never, what I've learned is doctors are told in school, don't ever say anything's 100% safe because it's not. So when somebody wants to say to you, well, it's 100% safe, if we're talking a surgery or we're talking medicine, well, that you can't guarantee that because everybody's body is different.
Yes.
Now, I would say we could say with Reiki that Reiki is safe because Reiki is like superficial touch and energy medicine, but are all types of massage completely safe without risk? Absolutely not.
Right.
That's why I have contraindications that I have to know. So there's a very like thin line of, yes, when I take your blood pressure, you're probably going to be okay when I weigh you, you know what I mean? But like when I start doing other things, there's a slight risk. And that's important that the patient is educated on it. And then you were talking also, and you can say what you want to say first, but like about insurance. And I think that's important to mention.
Yeah. So you're an informed consumer, first of all. So you should have the entire picture when you agree to, an alternative therapy of any sort. What I wanted to say was that you shouldn't just go off of your own medical plan from your doctor, right? Like, so if you want to try alternative medicine or integrative medicine, that's great. And that's what we're talking about, the benefits of those things. But there is a risk of you dropping, certain medications or plans or things like that a doctor has prescribed already. So you do want to be informed. You want to know what medications you're on. You want to know why you're on those medications and, what medical diagnoses that you have. I think that it's really important for you to know your body and know what you have. No one else is really. I think that for a while there was an understanding that the medical field, they know what's wrong with me and they're going to fix it. And, while that may be true in some instances, we are still people.
Yes.
We're, humans that are trained and, educated and, we're limited to our own experiences and our own exposures as well. So it's just really important, as a patient, as a client, that you advocate for yourself. You are the only person that walks in your shoes. You're the only person that has lived your life and knows, the things that have impacted you, or affected you. And I think it's really important to really empower people to understand that that's such a value and that you really matter and that you are the one that understands things more than anybody else. Does that?
Yes. Yeah. So, one of the things we can talk about is you can't just sit there and it's like, okay, when you go to get in a relationship, do you just trust the person 100% or is trust built over time? So you can't just unknowingly walk into any kind of medical office and just be like, I 100% just let go of any of my will and I just hand it over to you, because there's still a responsibility for you to be educated about your body and how you're treating your body every day and your habits. And also, if you start taking a medicine, what does that mean on the side effects so that you can pay attention to if those side effects are starting to become so negative that medicine just it's not useful for you. You need to try to take a different medicine or go a different route. And so I do think when we're speaking that way, that we know that you have to advocate for yourself because you're the one who's the best advocate. You're the one who lives in this unique body. I've taught in Reiki, like we could have 10 people all with MS, but the causes of why it happened or their symptoms can somewhat vary.
For sure.
Yeah. And sometimes it's hereditary. Sometimes it's actually become stress induced over years. So it's not just all black and white, right, for the same conditions. And so when you were bringing this up earlier, I think it's really important. Like we were saying, like insurance, like doesn't cover most holistic approach medicine. Now, some of it is starting to be with integrative medicine, but the problem is insurance then kind of limits what will be accepted and covered. And that can also stop you from getting the care that you want in your own mind, or you saying, no, I won't get it now because it's not covered. But I don't always agree with that because of several things I have faced.
Right.
Yeah.
I think that there's value in your own healthcare and maybe value in if an integrative approach, where you're looking at what your medical doctor has as well as, the energy medicine or the integrative other things, and we're talking acupuncture, massage, Reiki, meditation, you name it, right?
Yeah.
Some companies will cover certain things and they're becoming more aware of the impact it has on your own mental health, which then affects your physical health, which we've talked about, and I think that it's unfortunate that we are sometimes that our paths are dictated by what insurance would cover, right? But I think that it's really important to invest in yourself. Almost think of it as an investment, right? So if insurance isn't covered, like, okay, maybe I don't go to dinner 3 times this month, instead I go for a Reiki session. And not that it's that expensive, but you know what I mean? I mean, just something to that sort of, you balance, right? You find that balance of what's important to you. And I think you need to have, in a trusting relationship, you need to have trust with your physician to sort of say, I would really like to try this. Is there any, is there danger in that? Is there, and if you hear an answer that your gut instinct is just saying, I'm really not sure if that's true. It's okay to seek another opinion. It's okay to really trust your own instinct and your own gut, because we have our intuition for a reason. And it could be, the Holy Spirit's talking to you, God's talking to you. There are so many reasons and such value in your own, I like to say spidey sense, but it really is,
That's so funny.
Yeah. So yeah, I think.
Yeah. As we're talking about, first of all, I want to say that working in the medical field, in any area of the medical field, is not easy. Caring for others' health and trying to do your best, being a surgeon isn't easy. Being a massage therapist isn't easy. Being a nurse isn't easy. They're very, there's a lot required of us. And yet, I still think that it's important to say there are really, really great people in every single field. And then there are people who are like kind of mediocre. And then there are people who just don't care and they aren't so good. And that's in any field, not just us talking about the medical field. We can talk about a construction worker. We can talk about a teacher. It's all about, does the individual actually care? Are they hearing me? Are they listening to me? And when you go into any kind of healthcare setting to get treatment of any kind, the person who's talking with you to give you treatment should care. Their responses to you should be they're listening to you. They're actually taking cues by the symptoms that you're having or by the tests that they're running. They're still also listening to you, and they don't push to the side what you're saying, right? And so I don't think in any of the years that I've been taking care of people that I haven't made them feel unheard or like I didn't care. I've never been rude. I haven't been anything. Does that mean on the inside, do I always agree with everything? No, but it doesn't really matter whether I agree or not. Like we all have our own views in life, but it's about actually seeing the person and what's my role today? How am I supposed to fulfill my job to better their care, to make them feel better, to better their body and their health? That's just it. Yeah. And so I think that when a doctor doesn't want to, or a medical practitioner doesn't want to hear you, or they start talking down to you, or they start treating you poorly, or if they remotely yell at you, seem impatient, are rude, act like what you're talking with them about is inconvenient or like you're stupid, you should honestly just get up and walk out, because even to have just a consult for some things or any of that is hundreds of dollars. And I don't know about you, but I'm not going to give my body, which is the only body I have, to anybody to help me when I need healing or a surgery, who's not going to treat me well. And I think that's one thing that we want to talk about today is, if the treatment is poor, get up and go somewhere else. Don't think that you're stuck being treated that way. I know way too many people who stay quiet and then step into my office and share how upset they are about what happened or the way they were talked to. And I'm like, you can open your mouth. It's important for you to open your mouth. And then, of course, it's once anybody has a good doctor, everybody wants that doctor. Give me that name. Give me that name.
Yeah. And then you can never get in with that doctor, right?
Yes.
I think as you're talking, I think that this is part of why I think that nurse coaching is so important and valuable, right? Mm-hmm. Because it's an opportunity for me as a nurse with a medical background and understanding to kind of look at the whole picture, to maybe ask questions, to seek a little bit more information from you as to what is important, yes. So we can look at the entire picture. So we can look at your mind, body, and spirit and what makes you tick, and really find the goals that are important to you, and help you to articulate maybe even the questions that you need to ask, or that would be beneficial to ask, so that you get, the answers that you need, or, how do you have a conversation, right? How do we interact with each other in a trusting, caring way, and just the value that is in that, and the importance that is there. I as you're talking to, right, it's not. Everyone in the medical profession, I feel we're caring people, right? I say this with I'm a nurse. And, I went into it for the reason that I wanted to take care of people. I wanted to take care of others. Now, 27 years into it, it's definitely different than I would have envisioned, right out of school. That being said, I still find value in having interactions with people, and the value in looking at the whole person. What I'm finding more recently is that we're starting to look at the whole person, but we might not completely be there just yet. Mm-hmm. So, whereas, if you hurt your arm, you're going to go in, you're going to get x-rays, or, maybe it's broken. So then you're going down this path of okay, you need surgery, or you need a cast, or, so then you have appointment after appointment. And okay, yes, this is something that needs to be done so that you can take care of that problem. Mm-hmm. We want to be sure that you have comfort in that path and that plan. What comes to mind, this is really interesting and strange, right? Let's see, in 2004, I fell and broke my leg, and I broke my tib-fib.
Both.
Yeah, both. And I was, I went to the emergency room. They were like, oh yeah, you broke it. We were in Cincinnati at the time, so we had to drive home. I was riding on it's not a pretty experience. Anyways, we get back, and I was told to follow up with an orthopedic. So I go to this orthopedic's office, and comes in and looks at the x-rays, and like, yeah, you broke it. You're going to need surgery. And then proceeds to say, well, yeah, I've done 5 or 10 of those. Well, that's a big difference, right? Like, have you done 5 or 10? So, my spidey sense went off just a little bit, right? And I'm like, this is my leg. I need it to be fixed so that I can walk on it and I can function as a human being later on. And, there's so many things that right. Later to find out that he was a hand surgeon.
Oh.
Okay. So there is a point in time when you as a professional person can say, I have a colleague that would be really great at this, but I don't know that I'm the best person for you.
Yeah.
There's such value in saying, I think the more you know, the less you know, right?
Yes.
And for you to say that you don't know, people that say I don't know, I respect them so much because it takes a lot of guts to say that, but there's no way that everybody could possibly know everything.
Yes.
So and to back up, right? Like we have knowledge, we've educated ourselves, but we still are on that path to what experiences we've had. So whatever road you're on, right? The intersections have come in, and the experiences that you've had or the research or knowledge that you've gained have all been because of experiences that you've encountered. Mm-hmm. And you may not have encountered the things that a new patient is coming to you about.
Yeah.
So you have to respect that.
Yeah. And it's okay to, like you're saying, to not know.
Yeah.
Like, there are times when I can do, a certain amount of body work, and other times I'm like, I know somebody who's better trained in this specific modality. I'm going to send you to them. Or I really think you need counseling paired with this, because I'm witnessing by the feedback constantly that you need also another modality brought in to get better.
Yeah.
And I don't at all feel ashamed. I don't, humility is really important, and it goes really far.
It does.
Yeah.
Yeah. And I think thinking of things as your toolkit, right? Like it's your healthcare toolkit. What are you going to put in that, carry-on bag?
Yeah.
It's things, so you can feel comfortable to vocalize your opinion, and really the things that mean a lot to you, you should be able to vocalize those things too. I think so. In the role that I'm in now, I'm a care coordinator, and I think that the most frustrating thing is that it's so hard to watch people go through things and not know that they can ask a question or not know where to go, right? Like, so maybe it's, a social worker that's going to help with this. Maybe it's, another physician. It's a specialty physician. It's, there's so many different people that can help, that have specialized in things. Could be a therapist, a physical therapist, an occupational therapist, a speech therapist. There's just so many different facets that can really help you create an individualized plan that is best for you.
Yeah. Yeah. I, when we're talking about insurance, and, I would say to most people, most of the things that pretty much all the things, if I think about it, that I seek alternative care and are not covered. And I know that means to some people, well, then it's not covered and that's expensive. But, how would I say this? So, I was recently, and I don't need to go deep into it, but like they wanted to do surgery on me. They wanted to do a hysterectomy on me. At first they wanted to do one surgery. I didn't feel comfortable doing that. I went for a consult. Then I got my biopsy results, and this was like in the fall. And then it was like, we want to do a hysterectomy. But I'm really, really smart medically, thank God. And I didn't feel like that was right, because even though I was like the last stage before cancer, like it wasn't cancer and it hadn't spread. It was very localized. And so I did research for like 10 days. And I felt like I was awfully young, and I see women, I mean, don't get me wrong, sometimes you have to get a hysterectomy, but if you can avoid it, There are vital things that a woman's parts that are in there tuck everything in so they don't cause issues later in life. And so if you can save it, you want to save it. And so after researching 10 days, I found these treatments out of state that doctors are allowed to perform, not in Ohio, but naturopathic doctors in other states. And I know 2 people who just had hysterectomies, and I think they told me it was about $60,000 just for the surgery now. That's how expensive some of these surgeries are, $60,000. And then I would say to you, how much does insurance cover, and how much do you think I would have been stuck with? I mean, easily we could say 10 to 20 grand at least.
Well, sure, because most plans are 80-20, right?
Yeah.
Where you're responsible for 20% or your deductible.
Yeah.
And I think that's, as you're talking, it's important to know what your insurance is going to cover.
Yes.
Right? Because you can even find like a medication may be ordered, and you may be able to get it at a retail pharmacy cheaper, or if you go to a hospital affiliated, pharmacy, it may be cheaper that way. So there's a lot of different avenues that you can get things that maybe would save you a little bit of money, or would at least feel like it's in that realm of correct for you.
Yeah. So what I think is interesting is, first of all, the surgery actually would have only bought me time. I'm really smart, and I brought up to the doctor something that doctors won't just release, because again, they're only allowed to release certain things, which is sad. But I had just said, so you could take all that, but it's still going to come back in other places of my body. And I think they were shocked that I was that smart to know that and say that. And they said yes. And I said, I have to build an immunity is what I have to do. And so they said, correct. And so that's what I researched. These other treatments, I had to travel out of state. I had to pay for a hotel. I had to pay the doctor. I had to pay for a ton of natural, supplements and things that all have proven history since the 1960s, and all the studies that actually work towards putting this in remission and all these things. And I think it was 12 treatments total that I had. And I'm telling you, and we're not even talking about the pre-stuff before a hysterectomy, the aftercare, the doctor visits. I mean, I would have easily said it probably would have ended up costing me 20-something that I can think of, knowing, what the cost would be in insurance. And we don't have bad insurance, but, and I would probably guess to say, if I calculated all of what I had to spend, and now I'm in complete remission and fully healed. I don't have one single bad cell down there, and tested negative and built an immunity. Praise God. I just got that last week. And the travel cost of the hotel, I think it might be $6,000. Yeah. And so, again, you're sitting there saying, well, but insurance doesn't cover it. And I'm like, yeah, but now there was another doctor who did it that just wanted to charge me $10,000 to boot.
Oh.
And without all the other stuff and the travel and all that. And I was like, nope. I kept praying, and I kept interviewing all the different naturopaths who did it, and found one that was well within my range, because, even though I run a business, I'm still middle class. I'm not wealthy. I still have, society, everything's gone up. Everybody's just trying to get by. And so I feel like I would encourage people to do more research sometimes, or also check, yes, what does insurance cover? But if I went the natural route, what does that mean? Or was I smart enough to even ask and question that this wasn't going to be the solution to save my life long term, but to only buy me time, which wasn't given to me the information. Yeah. So, and I don't blame the doctor for not telling me. I'm well aware of how everything works, but at the same time, I think it's research before you ever say yes to any kind of thing. At the same time, if you are in a car accident and you don't even know you're getting surgery and they're saving your life, that's a completely different thing that we're talking about.
Right.
But when we're actually talking about that you have time to not react in fear, which is never a good way to decide your healthcare surgeries, you know what I mean? And your risks or the benefits and risks, then you need to step back and take time to decide. And that's the best way that you can honor yourself and find the best solutions. And in the midst of it, not many people knew I was going through it. Like, we're close. And so I told you, and I told certain people that I wanted praying. Some people didn't respect my choice or support it when they found out. And I just, at those times, sometimes when you're doing something holistically, it's kind of like, I know you love me, but that's not really your choice. Again, it's your body. So always do what you feel, what your gut instinct constantly leads you to, because now I'm sitting in a completely different position for the rest of my life. And I know how to care for myself with this,
And I want to add to that, you advocated for yourself, right? Which is huge. And that's the piece that I think we want everybody to know. You are your own best advocate. And it's so valuable and important for you to say, I don't know that I really feel that this is the best option for me, right?
Yeah.
And it's never easy to do 10 days worth of research to get to the point of where you got, or to find that, like, okay, yeah, you could have paid $10,000 and had the doctor, that was going to do that. But that's not the path that you were meant to take. And I think, you knew that. Your intuition told you that there was something else out there. And you advocated for yourself, and look at where you're at now.
Yeah.
And there's such value in that. And, whether you're advocating for yourself or your loved ones, if someone is, even a family member is talking to you, right? And you see that they're maybe struggling to get across some information or to understand why they're on a certain medication, just listen to them and really try to figure it out together, right? Mm-hmm. So advocacy is so huge. And, with everything that we do, right, we try to be good consumers. Healthcare is the same thing, only it's even more important because you're given one body, right?
Yes.
And you make the decisions to live your best life, what's so important, like you really need to take care of yourself, and advocate for yourself and really feel comfortable with the plan moving forward.
Yeah. Yes. And, I don't want to bring up, patient stories, but I can speak for my own stories. Like, two things I would say is, one was when I went for the consult for a different procedure with my doctor, this is what they first suggested before the biopsy, knowing that there was something serious wrong. When I had read about it, the side effects that women wrote about were really bad and like not good. And I tried to talk to her about it, and she treated me not good. And she treated me like I was an inconvenience, and how dare I question. And I've done a ton of them, and no women tell me that. I've never had a woman have any side effect. And I'm like, maybe they don't come and tell you, but like acting like there's no side effects to any surgery ever is unrealistic.
Right.
I mean, tons of people get knee replacements, but they're never the same afterwards. I take care of them all the time. Sure. I know it. You know what I mean? Sure. So like, we're not the same after any surgery. Our body is different. And so I remember I left, and then I didn't go back to her. Mm-hmm. But she had no clue who I was. And that's the other problem is, like, I have a pretty big medical background. And then I ended up writing that letter to tell her like what I learned and how far I came in this alternative treatment, why I'm so happy I chose it, but also saying it's not okay to treat people like they're an inconvenience. I'm spending hundreds of dollars just to talk to you for 15 minutes about my fears of this surgery or the side effects so that I can choose, because I have to live with the side effects the rest of my life. Mm-hmm. I don't blame doctors for the protocols that they have to follow that right. They think are best, but they have to be able to hear your fears and respect it and answer your questions so that you can decide, because they're not the ones living with the side effects forever. Sure. And that's where I feel like it's so important to hear people. Yeah. And also understand that we're treating a human being that has feelings and emotions, and this is like their body, it's just another person, another patient.
Right. And it's unfortunate that we can get away from that sometimes, and I think it's hard because, screenings are important, right? And to go through those things it's super important, and, it can save your life, and that's like so valuable, right? But when you get the results, you have to be able to kind of sit for a second and take a breath and kind of pray about it, right? What's the next step? Does that,
Oh yeah.
And I want to say that sometimes through no fault of anybody's, own, it's just that this is the medical training through medical school, through residencies, through different things, like this is the knowledge that they have. And these are the options that they can put forth because this is what they know.
Yes.
Right?
Yes.
There may be other things out there, but it might be your responsibility as the patient to try to find them,
I totally agree with
Yeah.
you.
Within safe means, right? Like if your life is in danger or, those types of things, obviously, like, okay, we have to be realistic about it too, but it's just so important to be aware.
Yeah. So I can say, they said, we would want you to get the surgery within 6 months. Well, I figured I could give this treatment 6 months. If it was working, I didn't have to panic because I already wasn't going to be in the same place.
Yeah,
right.
right.
But I'm with you. I was like, well, this has to work or you're just going to swallow the pill of that's the surgery you need to get,
Sure.
But I agree with you. It wasn't like completely off the table until I knew that this was working and that it would come to completion on the other side.
Yeah.
So yeah, like, I agree with you. We can't just say, well, I'm just going to put it off forever.
Yeah.
And then that makes you, literally risk your life as well. So being smart about it.
Yeah.
Yeah.
Yeah. Yeah. And yeah, I think sometimes it can be hard to even do the research, especially you're very savvy and you're, a medical background. And so you have the ability to kind of read through things because that nowadays too, it's like, what's fake news? What's AI? What's right? Like, where is the information coming from? So, it can be tricky. And I think it can be tricky. And so while you're doing that research, I think you have to rely on your loved ones and your other, your colleagues that you really trust and, feel supported with. And you need to kind of have that community and build that community around your plan, so that you feel supported also. Because the other piece of that is as we know, right, some things, it's mindset. Like they have placebo pills, right? Which are just sugar pills that you take versus a pill that has, actual medication in it. And sometimes the placebo in your mind, if you think that it's going to work, it works. So our minds are very powerful, but you have to be able to be on board.
Yes.
And aware and in agreement with the plan ahead, because that's what really could save your life.
Yes. Yeah. Yeah. And then I wanted to also bring up, can you explain more of like what integrative medicine is?
I can try the best. So integrative medicine, functional medicine is something that is newer. I want to say we're becoming more and more aware of it. Still, it is where you have maybe a workup by a provider that is vested in looking at your whole person. So your mind, body, and soul, right? Too. And so they can look at lab work and, different things and sort of see like, are you deficient in metals? Do you have a certain overload of certain metals? Like there's just so much that I don't think we really realize goes into our health and the exposures that we've had. And, some people, like you talk about gluten-free, or they don't tolerate gluten. There's so many different things out there that I think integrative medicine really does look at alternative therapies that we can try too. Like, do we do an elimination diet to see if, you feel different if you take away dairy or you take away flour or you take away, and then we introduce things back into. So it's creating a plan around that may not be the way that they learned in medical school, but but may look at a little bit more of your diet, the things that you expose yourself to, and sort of what impact all of that has.
Yeah. Yeah. And I think our body changes as we get older. So, you can have resistance to some things and they start to aggravate your body differently as you age, which is very normal. I think as we get older, we have to say no more to toxins and accept that whether we like it or not, if we're going to advocate for our health. We can get away with a little bit more when we're younger, but as we start to age, we really can't. Right. And everything starts to change. And every decade that we get older, our body changes. And so we have to learn how to respect it more and almost allow ourselves to accept the aging process and learn how to care for ourselves at the age that we're at. Accepting also that might mean that I limit certain things, but those things honestly aren't fruitful anymore, and so they make you suffer. So what's the point? It's all about self-love,
Yeah.
Yeah.
And I think, a lot of that is so true, is, finding that plan that works where you can love on yourself, right? That self-care that's so important and valuable and is included in you aging, how do I want to say?
Just well.
Yeah, aging well.
Yeah. The one thing too that I wanted to bring up is I don't think people know enough about holistic chiropractors. And, I've been under care of a holistic chiropractor since I was, I think 30. Pretty sure I was 30 or 31 or 32 when I started. And they do a lot of things. Even when I had my back fracture, he didn't want me to tell him where, even though I knew where. And he used a tuning fork on my back and found exactly where it was. And he was correct. They muscle test. And some people are like, are muscle testing real? Yeah, it's very real. Experience it and you will realize, how much your body will communicate with you that you might have a deficiency, that you need that vitamin or that mineral that you don't. And I'm so used to being in his care. He helped me through when a topical cream almost caused my liver failure, which is actually still on the shelves at CVS and other places. But when you look it up, is actually responsible for causing liver failure in older adults. And it's just a topical cream that you would rub on the body, but that's how harsh sometimes topical creams can be. Very hurtful to the liver. And he helped me cleanse my liver. And through muscle testing before I cleansed my liver, he figured out I had gallstones.
Wow.
And I did a cleanse for cleansing them. And I saw them. So I knew I had them as I cleansed. And then we did the liver cleanse and everything else. And my body, the symptoms that I was getting that were unexplainable to me because I work out all the time, I do all these things, completely transformed the way I felt. The same muscle testing that he did when I finished all the cleansing was that much sharper, where I was so weak when we first started. And all my symptoms went away. And that was really what changed the whole trajectory for me into holistic means.
Sure.
And do you know, he did more for me after my back fracture than anybody else. And same thing, even through this, I would go to him just to make sure that my body was staying in alignment. We kept certain meridians or my nervous system calm because this was a lot. Even the treatments holistically weren't easy on my body. I feel like holistic chiropractors, to me, and they'll always say, I'm not a doctor, but I honestly feel like they are. They are doctors, but they're doctors of just naturopathic medicine. And there are some of them that are so gifted and can honestly adjust so many things, and most people aren't even aware of their scope of practice.
Right.
Yeah.
Right. Yeah.
It's interesting.
It is interesting. And it's amazing when you do find the right doctor that has the right skill set for you.
Yeah.
So yeah, there's that piece of it too.
Yeah. Well, we just want to thank you for listening, and we don't want to talk so long if you have other things to do where you take in only so much information at a time that it's beneficial to you. But I just want to thank Laura for coming, and we want you to just remember to advocate for yourself. Make sure that you know that you're getting treated well in your health care. You don't ever need to be treated as if they don't care about you, and you have a right to say no to any surgery, right? As long as, again, it's not an emergency thing, that's going to be different, right? Like if they're saving your life, they're doing what they have to. But we're talking about like in your care plan, you can say no, you can ask about alternative surgeries, you can get multiple opinions, you can see what the holistic route would also be, but still making sure that you're doing things in a safe amount of time. And also understanding the limitations and the laws and the rules that all of your healthcare practitioners have to follow depending on their title, and realizing that that might not be in their scope of practice and you might have to do more research. So please, please take care of yourself, advocate for yourself. You have a right to say yes or no. And thank you, as always, for listening. Speak life into yourself and others, and we really hope you have a blessed day. Thanks so much.